Acupuncture points are specific spots on the body surface where a practitioner applies stimulation for the treatment of the disease. Acupoints are typically located in or near muscles, blood vessels, lymph vessels, or nerves. Each acupoint has a unique location and physiological effect. There are several different naming systems currently in use. The one I will be using is the meridian numbering system. For each point, it receives a unique combination of letters and numbers to form its name. The alphabetic prefix is the abbreviation of the meridian on which the point lies. The numeric suffix represents the sequential position of that point on the meridian. For instance, there are 45 points on the stomach meridian. Thus, the first point on this meridian is named stomach 1, the 36th point is stomach 36, and the 45th point is stomach 45. One may use an acupoint for treatment of local problems. For example, one chooses points largely based on their proximity to the troublesome area. Distant points may also provide therapeutic effects. In these cases, one chooses an acupoint that lies upon a channel passing through the problematic organ or location. The most common needle type used in veterinary medicine is this kind, the filiform needle. It has a tail and handle. The thin needles are typically less stimulating and are used for weak and geriatric small patients. Thick needles are more stimulating and are used in strong and large patients. Insertion or guide tubes allow students at an early stage of their technique development to adequately place needles in a patient. Ideally, the patient should be positioned in a manner that will allow for a complete acupuncture treatment. For small animal practitioners, they usually work in a position in which the patient places her or himself. One of the most important aspects of positioning is for the practitioners to take a comfortable position that allows easy escape in times of danger. To reduce stress, treatment is commonly performed on the floor for dogs. You will use mats or blankets to provide a comfortable cover on hard floors for the duration of treatment. The selection of local points I have chosen for Cali is based on her having hip dysplasia. So I will use bladder 54, which is indicated for paresis, paralysis of pelvic limbs, hip problems, perianal problems, or lumbar pain. I will also use gallbladder 29 and gallbladder 30. That is used for gluteal muscle soreness, pelvic limb pain, arthritis of the coxofemoral joint, or paralysis of the pelvic limb. These are found near the greater trochanter. In a well-muscled dog, the greater trochanter is deep to the thigh muscles. It is not a point that necessarily sticks out. You have the gluteals that are coming in, dorsally attaching, and then you have the biceps femoris and other thigh muscles coming up to the greater trochanter and the coxofemoral joint. A patient with severe hip dysplasia or a lot of muscle atrophy at that point, the greater trochanter will stick out and you can visualize the bony protuberance. So I'll search for the greater trochanter, and in a depression just dorsal to the greater trochanter of the femur will be bladder 54. Then gallbladder 29 is in a depression just cranial to the greater trochanter, and gallbladder 30, keeping my finger on the greater trochanter, I'll then put my finger at the point of the ischium, and then in a depression midway between the two will be gallbladder 30. So using my tubes, I'll palpate, find the depression. The number of needles in the prescription affects the outcome. The old and sick patients will tend to be weaker, so they'll require less needles. The needle retention times will vary from 9 to 30 minutes. For someone like Cali, who's 13 years old, I'll usually keep these on for about 10 minutes, 10 to 15. And then when I'm ready to withdraw the needle, it should be uncomplicated and pain-free. And so typically I would just allow them to sit, but for presentation, I'll just show that you just stick them right out.